In this episode of Tales of an African Vet, we track a wild African cheetah through the bush. It has a heavy collar around its neck that needs replacing. This is wild African bush, and you just don't know what lurks behind the next one. By now you're probably asking yourself, why collar them in the first place? Well, these are game reserves. They have fences, and animals can get out. Neighbors may not be as friendly as they should be, and if these animals stray onto tribal trust land, they will be shot. It's really imperative to know where they are at all times. This unsightly collar can actually weigh up to 3 kilograms. And besides the extra weight that the hunter has to carry, there is the chafing factor that also is a problem. Successful surgery doesn't only rest on the skill of the surgeon, but also depends on careful planning. You have to dot the I's and cross the T's. Nothing can be left to chance. And in the bush, this presents its own unique challenges. Intravenous lines are secured, fluid administration is set up at a specific rate, our patient is positioned for the surgery, and everything is set to go. The radio implant is immersed in sterilizing fluid before being placed carefully into the abdomen. The patient is shaved and scrubbed prior to surgery, and everything is ready. Surgeon washes his hands, puts on gloves, the patient is carefully draped, and if you're squeamish, now's the time to look away. And this is the moment we've all been waiting for and been planning for. The radio implant is gently and carefully slid into the abdomen, and Dr. Rogers stitches the abdomen closed with 2 layers of sutures, one in the muscles and one in the skin. The radio transmitter is tested and the signal is strong. This indicates that the battery life will probably last a couple of years. Our patient is given an antidote to the anesthetic and carried to a safe spot in the shade. Antibiotics and anti-inflammatories are administered, and she's carried to a spot in the shade to recover. What a day! Just another piece of surgery carried out in the heart of the African bush.